So a lot of people are getting Brazilian butt lifts. That's probably one of the most popular procedures this last decade, right? So tell us how long you've been doing them. What's the gist of it? A general idea so patients understand exactly how you perform the Brazilian butt lift.
The Brazilian butt lift is becoming more and more popular. I've been doing it since 2005. And nowadays people give it different names: high definition Brazilian butt lift, this shape, that shape. Essentially, they're all the same, okay? You just have to follow the principles of Brazilian butt lift. Number one, you have to make sure that the patient has enough fat. I don't believe that you need to go and gain a lot of weight to come back, because usually after a Brazilian butt lift, you can lose that weight. And what happens when you lose the weight? Then the fat goes away. I rather do the Brazilian butt lift at the weight that the patient is most stable, so that after the Brazilian butt lift, the results become more permanent. When I do a Brazilian butt lift, I don't focus on the butt only. People come and say, hey, I want a bigger butt. Yes, that's the result of a Brazilian butt lift or buttock lipoaugmentation. We should really go by buttock fat transfer, because the Brazilian butt lift, there is no lift in it. Yes, when you augment a tissue, it becomes slightly lifted, but it's not a true butt lift. There is a true butt lift whereby we cut and actually lift the butt up 4 or 5 inches. A Brazilian butt lift is buttock augmentation using your fat. So buttock fat transfer is a better name for it. But it's not about the butt. It's about the whole back view. The butt is like a picture. If you frame it incorrectly using the wrong frame, it doesn't look that appealing. When you have a beautiful picture in a beautiful frame, it obviously shines a lot more. So the butt has to look nice on the back view. And I always talk about the back view. The back view is when you're walking on the beach in your bikini and the whole back looks good, not just the butt, okay? So I typically start my Brazilian butt lift with liposuction. We look at areas that we can liposuction safely. What does it mean to liposuction safely? Well, if you've got skin laxity, if you're a weight loss patient, if you have had multiple pregnancies and you want your tummy reduced, you can't liposuction those areas. You cannot liposuction, and you should not liposuction areas that have loose skin, because they become even more relaxed or lax after liposuction. So we go for areas that have skin that is tighter, skin that is less relaxed or lax, and liposuction those areas. So the back is a good area to liposuction, because typically patients don't have a lot of back skin laxity. The back skin is thicker, the dermis is thicker, there is more collagen, and it usually contracts and shrinks better. The other thing is people come and say, hey, I just want my love handles liposuction, not the whole back. Well, the problem is that when you do a good job of liposuctioning the lower back, then the upper back looks bigger. So it's always better to take care of the whole anatomical unit. And in plastic surgery, we talk a lot about anatomical units. Anatomical unit of the back is the upper back, the mid back, the lower back, the sacrum, the love handles. When you liposuction that bigger area together, and then the skin shrinks by 10-15%, you get a lot more skin shrinkage than if you liposuction one isolated area. So typically I start, and I've been doing this since 2005. If you look at our galleries, we have buttock lift galleries, buttock augmentation galleries with implants, a lot of BBLs, a lot of combination in weight loss patients whereby I'm lifting, I'm using the lower back fat pads to augment the upper butt, and then adding fat to the lower buttocks to get a rounder look. But for the average Brazilian butt lift, we usually start with liposuctioning perhaps the front, if they are suitable, and then turning the patient, doing the upper back, the mid back, the lower back, the sacral area, the love handle. Sacral is, by the way, the area just above your butt crack that usually harbors a lot of fat, and that has to be liposuctioned aggressively so it becomes very flat. And then I usually create a demarcation between the lower back and the upper butt by liposuctioning in a V shape, and then liposuctioning the flanks and the waist to create concavity of the waist area, concavity of the back known as lordosis, which a lot of people want, and they give it different names like the S shape or whatever, but essentially it's concavity of the back. So these are the principles of liposuction and Brazilian butt lift that have been established for many, many years, and Brazilians probably did this, hence the name Brazilian butt lift. And if you follow them, it doesn't matter what name you give it, but those are the principles. And then the fat is super important. How you liposuction the fat is super important. So as you know, I've done a lot of research on stem cells, fat cells. We have multiple patents in this area, but in a nutshell, it's super important how you harvest the fat.
Right.